whether you're the gypsies or you're the unhoused or you are reentry or you're foster youth. We're human beings, so human beings need love and we need fellowship and we need companionship. When you're a refugee, you are homeless. You don't even realize when you're in your car or you're sleeping on the floor or on a couch or in the garage or in the backyard of family and friends, you're technically homeless. Mm-hmm. We've taken everybody's life experience of how to work within the system, and we're trying to give all of that and wrap it all around so that we can inform them, nurture them, care for them, and love them.
We believe that the next wave of innovation is innovation in the area of social impact.
We want to try to bring awareness about the incarcerated.
A huge number of people are currently homeless simply because they cannot get legal help.
A safe place where they can get set free.
There's no hack for human connection.
Codependency is an addiction.
Do not try to do this big thing at once. Start with a little.
When you're searching for the gold, you will get back so much more than you ever thought possible.
So what do you think? The ball's in your court. Welcome to the Innovate podcast powered by Geo. I'm your host, Ted Haas. We're here at the House of Web3 in the Presidio in San Francisco, right next to the beautiful Golden Gate Bridge, and the subject is about innovation. Let's solve the world's biggest challenges. It's about bringing the innovation that we've seen in the technological field here in the Bay Area, that the Bay Area has been known for, to the biggest challenges facing humanity, like homelessness, human trafficking, prison recidivism. Unfortunately, the Bay Area is also a leader in those areas. But we believe that can all change, and so Innovate is all about connecting with innovators who are doing amazing work and seeing if we can bring them together to not just do amazing work individually, but collectively as a team that changes the world. So my dear friend, Kathy Chao Rothberg, is an amazing innovator. You're the leader of Lao Family Community Development. So why don't you start by introducing yourself and Lao Family?
Hi everyone, I'm Kathy Chao Rothberg. I'm the CEO of Lao Family Community Development Corporation. We are a 44-year-old private community-based organization that's headquartered in Oakland. And our mission is to advance the health, well-being, housing, and economic mobility of our Northern California's diverse communities.
So you're getting incredible results. Just as a teaser, we're going to get into this later. Working with the homeless, chronic homeless, and also the reentry population in your different, you have one Motel 6 and you have other facilities. You can get into the details, but in 6 to 18 months, you have a 95+% success rate of graduating them, re-entering them back into society with first and last month's rent, a job that pays a living wage, ideally one job, sometimes it's two jobs, but ideally it's one job. Phenomenal results. So we'll get into that more later. But tell me more about your history. You came over as refugees, right?
That's an interesting question, Ted, and I was reflecting about that myself. You know, when we came to America when I was 7, this is in 1978, we catapulted, if you can imagine, that we left because of war and we had to escape. And we didn't have much time to prepare. We just had a couple of days to prepare and take everything that we own in just a few bags and to escape on a boat in the middle of the night. Really, it was 4 a.m. after we had waited at the Mekong River for hours for a team of people that my father had hired. Really, they were Thai mafias to take us out of Laos to Thailand. So our family, in essence, we were homeless for about 3 years. We were going from camp to camp. So if you can imagine the sheds that we see out on the streets all over or Northern California, the Bay Area, the makeshift sheds and tents, cardboards, pallet, pieces of wood, the junk that's on the sidewalk, that's how we lived for about 3 years. Wow. And because we were refugees, the government of Thailand did not give us official status. And so through the graces of churches as well as the humanitarian organizations and the State Department and the United Nations, we were finally able to come to America in 1978. So here I was, a 7-year-old child who didn't speak English, who lived in the mountains without hot water, without toilets, without the things, the systems that we have here in America. And we didn't speak English, a word of English. We catapulted to the Tenderloin in 1978. And here we were living in a SRO and trying to figure out
A whole family in one room.
the whole family in
How
a
many of them were you?
YWCA, and we were 9 of us.
Wow.
In an SRO, and we were there in San Francisco for about 2 weeks before we made our way to the East Bay. And shortly after that, my father started Lao Family in 1980.
You guys are settled. He starts helping others.
Yes, he luckily, because of his connections, he had a job as a job developer with a nonprofit organization.
And he didn't speak English? He had to learn English? Or?
He spoke some English because of the fact that he was a financial officer for the Royal Lao Army in Laos. So he did have some English. And then he went to a community college here, Contra Costa Community College District. And he helped new refugees to get resettled, to get oriented, to learn about renting housing, how to enroll the kids into school, the public health system, the education system, how to drive, how to get a bank account, what is it to be a renter, all the things, the education system. And so I reflect a lot about this, about why we do what we do and how we develop our model with the genesis, with the foundation in our own journey, as refugees, where we had to resettle and learn a new country and a new system.
Yeah, I was describing you to a friend of mine, and they said, well, you're an innovator. And I said, the driver for her innovation is really just love. She loves family, she loves people and helping others. And I love how you guys just developed this skill out of, you had to live it yourself, and then you just wanted to help others. And then as you grew, initially, that's where the name comes from, Lao Family, because you're serving the refugees from the Lao family of nations after the secret war and the Vietnam War and all that. And then tell how you pivoted.
Well, it was a very interesting journey because, like you said, in the beginning, we were serving the 5 different tribes. And we consider ourselves family, even though we weren't related. Some were related, but it's because we came from the same country, the same villages. And here we are in a new country. And any nomad group, whether you're the gypsies or you're the unhoused or you are reentry or you're foster youth, we're human beings. So human beings need love, and we need fellowship, and we need companionship. Peers. Just like imagine that if you were lost in the desert and you're trying to get to, safety. If you found another traveler, in the desert with you, you rely on each other to support each other because it's a hard journey. So it's the same thing when we came to America. The fact that we found somebody else who came from our village, even though we didn't speak the same language. We didn't even know each other during that time. But then we sought them out, and this is about building a network of support. So we look at the same thing that we do, because families that we serve and how we pivoted was that at first it was just refugees. But then we found that the Vietnam War, there was the boat people of Vietnam, the Amerasian children too, who came, who had fathers who were GIs, and they made it, or they had a relationship with a Vietnamese woman, and here they were Amerasian children. They could have been white with Asian, or they were black with Asian, or Latino with Asian, and they dealt with a lot of discrimination, in Vietnam. And so we were helping the Vietnamese people, but then the Khmer Rouge and the genocide in Cambodia also meant that a lot of Cambodians were coming to the Bay Area. And then one of the first wars, or the early wars in Russia, with actually Afghanistan and with the Russians supporting forces in Afghanistan. So there were a lot of Afghan refugees who also came. And then when the former Soviet Union broke, then all these nations were created, and then we had a lot of refugees that came too.
So you started helping refugees from wherever they were coming from.
That's correct. Whenever there's evil and there's war around the world, then refugees would come. But it was more than that. Of course, there were incidents that happened in Colombia and Guatemala and Honduras and El Salvador and Mexico. But then we realized, as we're helping more immigrants and refugees, that more and more people were also coming to our office who heard about us and how we were helping families who are on public benefits. So then more African American, more Farsi speaking, or other Southeast Asian communities or Latino communities were beginning to come to our office. At first, it was unusual for us because the population that we were serving didn't have reentry in their background, and they didn't have the traditional homelessness. When you're a refugee, you are homeless. You don't even realize when you're in your car or you're sleeping on the floor or on the couch or in the garage or in the backyard of family and friends, you're technically homeless. Mm-hmm. You may not be homeless on the sidewalk in an encampment, but you are technically homeless. Mm-hmm. And so we were beginning to study the data of our population, our customers. We found that our public benefits customers, several of them had those sort of homeless backgrounds. Then we also started to serve a lot of victims, many women, single women and women with children, or even elders who are neglected and financially abused. We realized that they all had homeless backgrounds.
So you basically opened up your doors to whoever needed help in the community. And you took this skill set that you'd built from your own experience and over the years of serving refugees, and that was the paradigm through which you serve these people.
Yes, that's correct, Ted. Because our board members, our staff, our volunteers that we hire that became a part of our organization, our extended Lao family, and the community that we serve is our extended Lao family, is that we took our own experience of being homeless ourselves, being excluded, not knowing the language, not knowing how to drive, not knowing the financial system, not knowing the education system, not understanding the human service system and the justice system, the banking system. America, or when you go to a new country, is made up of systems. It's the language, the culture, and systems. So Lao Family is a place where we have created life hacks for the community of our understanding of everything that we've learned 44 years of the organization's history. But imagine the combined experience of all the board members, all the staff, and all the volunteers. We've taken everybody's life experience of how to work within the system, and we're trying to give all of that and wrap it all around with the person who comes into our door and with their journey so that we can inform them, nurture them, care for them, and love them, and advance their goals so that they can quickly overcome and get back on their feet, be restored, help themselves, their family, be a good dad again, or a good daughter, a good mom, a good father. And then they could also support the community. So it's you, your family, and the community as your family.
Wow, that's beautiful. So this is, and you have a tremendous success rate. Like, what are your numbers with the traditionally, like you had mentioned, on average, from the time somebody contacts your organization to when they're resettled, which means they're in a safe place, dive into that. What are your numbers and what does that mean when someone's resettled?
So statistically, in the last 44 years, we have advanced the self-sufficiency of over 500,000 Northern Californians. On an annual basis, we serve about 31,000 people. And those 31,000 people, we deliver the service in 35 languages. They represent 40 nationalities, and about 50% now of our customers of the 31,000 are actually Americans who are high barrier Americans who are born here, who are from this country. And the other 50% is made up of a diverse group of foreign-born individuals. So on average, the customers, it doesn't matter how you came to our office. You can come through any door. And one of the things that we're very proud to say is that we don't say no to people. You always have to give somebody something, whether it's a warm connection to somebody else who can help them, or you meet with them and you try to serve them. We try to find 99% of the time, we will find a case management program that an individual could qualify for. And then once we put them in the center and find out what their immediate needs are, what is their intermediary needs, and what's their long-term need, we work together with them for that individual service plan. And then we wrap them around in a journey of all the other 60 programs that we have internally. But we also have 1,000 agreements, MOUs and operating agreements with landlords, with employers, with other community-based organizations, with churches, with the government. And then anything that we can provide for them, such as legal services or medical service or immigration service, we have a partner who will help to provide that for you. So then, on average, some of our families could exit our system and become self-sufficient in 90 days. For example, our refugees. Our reentry population, about 80% could do it in 6 months. And then 20% could do it in 12 months. And the literally homeless, the ones that are on the street, I would say our statistics, our data, is that 80% would take 12 months. And about 20% could take up to 15 or 18 months.
So basically what you're saying is it's anywhere from 90 days to a year and a half, and you don't give up on anybody. Most people get all the way through your system, and you're helping all of them re-enter.
Correct. So we help get you back on your feet, and so you can continue on your journey. We're a stop. When I say you graduate, and alumni, like our 500,000 alumni, let's say, for example, that you're a re-entry individual, and we could be working with the jail while you're inside the jail, so we're connected to you already while you're inside the jail. Or else through a partner, you'll come over to our office. We don't wait for a week or a month or a year to call you back. You can come in. You can literally walk inside the office.
Yeah, those are some of the best practices. Like, let's dive into those. One of them is the way you approach it, because our system out there is fragmented. People are, one organization provides food, the other provides job training, but it's hard for the individual to navigate that, and they need all of it. You put the person at the center, and you've gotten a skill, and you've gotten large enough that each of the different pieces that person needs, whether it's housing, whether it's job training, whether it's trauma and healing, and whether it's community, you guys are the community, whether it's transportation, food, all of that is in one place so that it can be around the person, and you walk them through it. They're not trying to navigate this maze of things. That's one of the best practices that you're able to do that determines the results.
Correct. And that took us a while to get to that place, but I want to share with you Lao Family's other brand. So the Lao Family Community Development portion of our business is the one that has all the social service, the workforce, the education, the support, the health, the human service. So we started off with that first. But in the beginning, we only had 2 or 3 programs, and then we were realizing that a person has whole person needs. Yeah. You can't just do mental health only. You can't just do English only. People have many things that they need, and they also have others that they need to support. So a person who's a man or a woman who walks inside may have a child. They may have a brother or sister. They may even have a parent or a parent that they have to also care for. So they have whole person needs. So then we started thinking more carefully that, you know what, we actually need to create community centers. The community center is there to serve the whole neighborhood, the whole community. Then we realized that our customers have specialized housing that they also need. And so then we started creating these casitas. The casitas are small villages that we're creating that may be a triplex, a fourplex, a 12 unit, 30 unit. And then we also realized that we need some efficiencies, and that instead of doing ground up construction, buying a piece of land, doing all the entitlement and taking 8 years to build a unit of housing, maybe a better solution might be for us to buy existing housing like that isn't traditionally used for housing, but we can repurpose it, such as a skilled nursing facility that's vacant, or we can buy a motel. Sometimes buying a motel seems really outrageous and expensive, and it is, but it's cheaper than ground up construction. It may be $65,000 or $125,000 for one studio, versus ground up construction that's costing $1.2 to $1.4 million in the Bay Area. Big difference. 8 years to do ground up construction versus 6 months to 12 months. It's about saving lives, Ted. 1,600 people are dying a year in California. So if we can repurpose a property that is greener, faster, more cost efficient, and this is one thing that people don't talk about, but I need to talk about this. When we rehab buildings, we're able to hire local vendors who are women and people of color. That's important for self-sufficiency of those communities, and we are lifting the whole community.
Yeah, this is one of the things I say all the time. The paradigm shift we need to make if we're going to solve this problem is stop seeing the people as the problem, but seeing the people who have challenges, but they're part of the solution. And I love how you're modeling that, both with all the 500,000 people you've served, but then the way you do it, you empower the community and you create jobs and you create the system while you go along.
Yes, that's right, Ted. I mean, earlier, the point that you're talking about creating this one-stop shop, which is what the community centers are, is to create the one-stop shop. Because unless you have tried yourself to walk, bike, and take the bus, the BART, the Muni, the light rail, the bus, you don't understand how long it would take. You might be a mother with 3 kids and you're pregnant, and you have to schlepp them all to the grocery store, to the DMV, to the Social Security. I mean, after one leg of the trip, you're exhausted already. But imagine that you have to go. I mean, I understand we're supposed to be efficient, functional. So you're supposed to go to DMV for DMV, Social Security for Social Security, childcare for childcare. But just imagine that we have these great systems in America, in California, in the Bay Area, but people fall between the crack because of the fact that you have to go from one place to the next.
You had shared the story that you had worked with, I think it was a single mother. She had done a whole lot of work. She had overcome her issues. You'd gotten her housed, you'd gotten her stable, she went through job training. She was all prepped, and you'd worked, and you'd gotten her an interview. And then it's across town, it's a bus ride, and she can't get there on time. And you're like, in the whole system, all that work, that one piece would fail the whole system. And now she does all that work. She's going to be discouraged. She's going to be at high risk of backsliding and going back into the old ways. Pay for an Uber. It's worth it. And you paid however much it was. And then after that, you got a grant from, I think it's Lyft, to help you do that.
That's correct. What we realize is that the cost to the system for that woman and that child for a Lyft ride, even for 3 months, in the beginning under probation, she might be under a probation period until she becomes a regular employee. For us, setting aside in our budget $1,000 for a person, so that in those situations that are really critical, that they need to get to that interview, they need to make it to work every day consistently, it's worth it, because not only the restoring that person, but the savings to the system is I think worthy.
We get policies. Let's the other thing I want to talk about is your pain points and what it's going to take to scale. Because I think one of the big issues we have here in the U.S., we have policies, but we have different groups that are doing amazing work. But overall, the system, just judge the system by what it is. We spend lots of money and homelessness is increasing. So the system overall is failing. One of the big issues is that it's a fragmented system. We have to bring it all together. Another issue is our response time. Like you say, when somebody calls you, you call them back within
30 minutes.
You guys call them back within 30 minutes?
That's right.
Yes, because if you don't call them back within that window, it's like emergency room services. If you dial 911, if you don't get a response immediately and 911's not there by like 30 minutes is late, if they're not, like I called 911 and they're there in 5 minutes because they're right down. If they don't come within 30 minutes, the science says they shouldn't even bother to come because the crisis is over. The crisis is advanced to the next level. So it's similar with social services. We have a window to serve those people, and if not, it's a crisis. There's no even point in serving. So anyways, you guys are an innovator. You respond quickly. You have this integrated system. You're getting phenomenal results. What are some of your pain points, and what are the reforms? What are the innovations we need to make to get much better results, to actually change the needle so homelessness stops going up year after year and we actually start eliminating homelessness?
Well, the thing about the pain points is it depends on the program. Every program has different pain points. Like, I'll just speak one. I'll give you an example. If it's a single mom with three children, and they're not able to work, maybe a couple of the children are disabled. So it's hard for the mother to be able to go out to work if she's a single mom with three children and two of them have disabilities, right? So that individual, that mother may only get maybe close to $1,000 of cash assistance from the government, right? And then she has Medi-Cal as well. And she may have some SNAP benefits. Those are really critical. She may not even have childcare because it's hard to get childcare benefits. She may not even have any housing vouchers because it's hard to get those vouchers. So here is a mother who has three children, two of them have disability. She wants to work. She's getting some minimum welfare of $1,000 and some SNAP benefits. The SNAP benefit may be $600. And then the Medi-Cal is very valuable because we need health care. We need a primary health care, and we need also clinical services and mental health. But if this mother starts to work, and because of her limited education, maybe she only has a high school diploma. She's American, she has a high school diploma, she doesn't have any college degree, she doesn't have much work experience. What's her likelihood that she can get a good, livable wage job? Not very likely. So let's say that she gets a $16 an hour job. How many hours does she have to be able to work? She has to work actually 3 full-time jobs. So she has to work 24 hours in order for her to afford a 2-bedroom apartment. And then when she starts to work, then her welfare benefit starts to be reduced. So then she has to make an economic choice. Do I work 24 hours? What human being could work 24 hours? And how is she going to care for her children? So the system with the public welfare system needs to change to give her some breathing room. Let her accumulate, let her work, let her have more than $2,000 in her savings account, because that's what they limit you to is $2,000 in your, who can survive? So that's a program that needs to be re-engineered.
So you've been an innovator from the get-go. I think perhaps your biggest innovation is this different paradigm of looking at the homeless through this paradigm of resettlement, of refugees. They're not fleeing a war in another country, but they went through their own personal war, and resettlement. But talk more about innovation, some of the most exciting innovations you're working on right now.
My husband and I, Ted, we kind of talk and laugh about this sometimes. And he always tells me, that because his family's been here, he's of Jewish descent, and his family's been here for 4 or 5 generations. And he feels like that sense of that drive of innovating is that refugee mindset, that immigrant mindset is further away from him. So I laugh about that, and I say, well, imagine that, you came to Laos now, you saw where I used to live, and you saw how innovative the refugees or the mountain people, like they had a tractor, a super thin tractor that had a family of 8 riding on the tractor in the middle of the road. They're building houses without blueprints. So I feel like since I came to America and since Lao Family was founded, and me individually too, it's always about how do you be creative? You have this system. The system has players, they have compliance, they have rules, but you're trying to solve a problem. You got to get to Z, A to Z, and you got to do it in the fastest, the most creative, the most efficient human level, and working within the laws. Like, you don't break the laws, but I might break the rules and I'll get to the edge. So with the purpose of really trying to help people to thrive and to elevate the situation. So for example, for a long time, I was a traditional affordable housing developer, and Lao Family was a traditional social service agency. And we dealt with so many different pain points and barriers to help our customer get to self-sufficiency. And the housing crisis, I've been a developer where I would buy land, it would be a contaminated trucking site, or it would be a agriculture land, and then we had to go through a lot to zone, to entitle, to go through public meetings, to put together all the financing to develop this housing so that we can provide housing for our people. What I saw in all my years in living in the Bay Area is that the crisis with housing, homelessness, with supply chain, with interest rates, with all the terrible things that's going on, is that we have we use that word, I think, too casually, that I feel like we've been desensitized. We truly have a crisis, and the narrative is that everybody thinks that affordable housing is the solution for homelessness. Affordable housing is needed, but that's not the reason why a person is homeless. A person is homeless because, number one, they've lost income. Number two, they might have had a disability. Number three, they fled a situation. Number four, they might be dealing with mental health as well as substance use, and their family couldn't take it anymore. And because of the fact that you have substance abuse or mental health, how can you pay your rent? How can you be a good tenant? How can you be a good neighbor? How can you be a good, it's not that you're bad. It's just that because of your condition, you're not able to do things that you're supposed to be able to do. Yeah. So what we were seeing is that this situation where waiting for a voucher was taking 10 years. Getting into an affordable housing, whether it's a tax credit or affordable funded project, was through lottery. You have 10,000 people applying for 200 units. And financing these affordable housing projects would take 8 years to find funding here. And then every day people are dying and they're on the street. So then we were thinking, okay, how can we innovate? How can we be more creative? So then we were thinking about hotels and about nursing homes. It's very hard to find an apartment complex that is 100% vacant. Because you can't buy a place and then kick these people out because you want to put your own people in. You just can't do that. Yeah. And so doing ground-up construction isn't an option because $1.4 million or 1.2 times 10,000 people in the Bay Area. How much is that going to cost? We've been spending billions of dollars in California for our homeless program, our reentry program, and what kind of results are we actually getting? It's worse than ever in the 30 to 40 years, almost 50 years that I've been here. So for us, one of the ways that we innovated was we started to look for vacant motels. And not necessarily in high crime areas, but medium to high resource areas. Because if you do affordable housing, it's a race to the bottom. it's a rubrics of scoring, and a lot of times, a lot of affordable housing is concentrated on low-income neighborhoods. That's not fair, and that's not the way it should be. The social determinants of health. Healthcare itself is like 20%. The social determinants of health is 80%. So where you live, your built environment, the housing you live in, your neighbors, your neighborhood, shopping, banking, schools, parks, the air, all those things are social determinants of health. So for us, housing is one of the most critical for the social determinants of health. So if we are able to buy a vacant nursing home that may be 13 or 40 units, or get a motel that's 100 or 300 units, the roof is there, the walls are there, the plumbing is there, the electricity is there, and the bathrooms are there, and the unit is there. Purchasing it, renovating it is much faster. And then one of the key parts, this is the unfortunate part. The minute we use government funds for acquisition, rehab, or construction, it immediately adds layers and layers of compliance and costs and delays to the project. So my call to action is really for the community to understand that if we want to scale, we want to solve this homeless problem, and we want to solve this housing crisis, we need the corporations, the family offices, high influential individuals, highly opinionated individuals who have the means to collaborate, to work with the innovators such as us that have connections to property owners who have thousands and thousands of hotels. And they believe in our mission and our cause, and they see the kind of work that we do. And so they're the ones approaching us and say, hey, Kathy, we have this property. This is a property that's in distress. We would like to sell this to you, or we want to lease this to you. We're a charity, we're a nonprofit social service agency. We don't have like millions of dollars in a fund, but we know how to do it. We have the connections, we have the results, and that's what we need help with, is for individuals, corporations, family offices, and those who have the means and the capability, who want to innovate and see results, to make California great again, to make high quality, to have our business neighborhoods and our neighborhoods to have the quality of life that we all deserve to live in.
Well, thank you so much. This really inspires me. When I talk to you, it's like if we, the real problem is the way you see the problem. And if we can change our paradigm for how we see the problem, we can solve it. So whenever I talk to you, you increase my conviction that we can solve homelessness. And, Abraham Lincoln said the best way to predict the future is to create it. Well, I don't know if he said that or somebody said he said that. So somebody said he said that. I think that's a beautiful quote. And for me, the future of California is a state without homelessness, a state without prison recidivism, a state without human trafficking, a state without vulnerability and unemployment. So let's envision that. Let's envision that together, and let's make it happen. So you're an innovator. One of the innovations is we've got to collaborate together. I describe you as like Steph Curry or Michael Jordan, but even those people, as good as they were, never won a championship alone. It's got to be a team. Collaboration is a best practice, and we have to address these problems not as their problems, not as Kathy's problems, not as some messiah on a white horse is going to come in and save us. They can't even see them as government problems. We have to see that they're all of our problems, and we get to define the type of society we want to live in. And if we all come together and we work together and we collaborate, we can solve these issues. So what your call to action is we need innovative philanthropists. We need someone who's forward thinking, who wants to completely transform the way capital is mobilized to address social services. I believe we are in the process of creating tools that will be able to change public policy, but we also need to change private policy. Philanthropy needs to be delivered in a different way. So if you're an innovative philanthropist and is forward thinking and is tired of just paying money, getting good results back, helping a few alleviate symptoms, That's wonderful, but if you're dreaming of actually changing the system and solving these problems, reach out to us. I'll connect you to Kathy. And that's what Innovate is all about. So thank you for joining us, and thank you for your attention. How do people find you?
People can find us at www.lfcd.org. And if you enter that same number, our phone number is also exactly on the pin, and on the pad. I want to thank you, Ted, for this interview opportunity. And I want to close with one word of advice for all of us, is that we can all change our mind. That's one thing that I believe, that to scale this housing first, coordinated care entry, the way we're doing homelessness reentry, it doesn't need to be done that way. There are other ways to do it that's more cost efficient, that's more effective and faster, because we need timely, responsive, people's lives are at stake here daily. So the bottom line is we can all change our mind.
I love it. That's a great word. We're only responsible for our own actions. So Kathy, you're also on LinkedIn, Kathy Chao Rothberg. Ted Haas, you can find me on LinkedIn or on X. I'll generally respond to a direct message. So we'd love to hear from you. Join the Innovate family.
Thank you.